Hello friends, today we'll discuss a very important topic, that is about the cervical cancer vaccination. We all know, we have discussed or we've heard from various doctors that you should get the cervical vaccination done. But the thing is, nobody explains us why should we get it done? Are we in the risk factor or not? What type of vaccines are available? What is the cost available? How is it given? And what is the age group when you can give it? So just to simplify all that, I'm just giving a brief intro about it. So it is basically, we have to give this vaccination to any girl who's, in simple language, any girl who's not been sexually active. You can give it to that girl. Preferably, we say if it can be given from 9 to 25 years of age. Mostly we say that. But anybody who's even given birth, who's been married and who's been sexually active, any person can be given cervical vaccination, because it is having more benefit. It is having more benefit than if it's say ki than not giving it. Whenever you give the vaccination, you're definitely providing some benefit to the patient. So this is the only cancer, cervical cancer is the only cancer which is having a vaccine available for it. No other cancer has vaccine available for it. If you have uterine cancer, you have ovarian cancer, or you have any other miscellaneous cancers which are there, you don't have any vaccine available for it. But if you have vaccine available for it, why is it not freely available? That is one of the major drawback that we have of this vaccine is not freely available, and it is not free of cost. You have to pay a good amount to get the vaccination done. But the thing is, it is providing so much benefit. The money that you spend on getting vaccinated is worthwhile. So you have to get 3 doses, that is 0. That means if you get it today, 0.5 ml intramuscular dose is given in the deltoid region, and then you repeat the dose at 1 month and then at 6 months. So 3 doses are given and you complete the regime of cervical cancer vaccination. So what benefit it is going to provide? It will prevent you from developing cervical cancer at the older age, where the risk factor increases with age. HPV vaccination, we say HPV is human papilloma virus, which is the causative agent for making a patient prone to cervical cancer. Because anyhow, the infection, again and again infection that occurs on the cervix, it causes a lot of changes, causes metaplasia, and finally the changes that lead to cancerous cell development. And if it develops, then you can't do anything. But if you are vaccinated, you'll be prevented from this cancer. You'll be saved from this cancer. So let's take a pledge and spread awareness and tell our young girls, our loved ones, and get ourselves vaccinated, so that we prevent this cancer from developing in our family and our near and dear ones. Thank you. Thanks a lot.